If you're thinking about having bariatric surgery and you haven't decided which procedure you're going to have, you're going to want to watch this video and maybe you even want to take notes. I am going to break down 7 different types of weight loss procedures that can help you reach your health goals. My name is Sean. I had a mini gastric bypass in March 2022. I lost 140 pounds, well, 88% of my excess body weight. And I am a health journalist and I've worked for an online weight care clinic. I'm now independent and I help people like you figure out their path to bariatric surgery in ways that help you save time and maybe even help you save money. A lot of people think that the only choices for a procedure or sleeve or bypass, and there are other procedures out there that you should know about. So that way, when you go to have your consultation with your surgeon, you're clear on what the different options are. You can ask good questions and you can make an informed decision with your surgeon. And I'm going to be honest with you and tell you that I thought I knew it because I'd researched it as a health journalist, but at the time there were some newer procedures that I didn't know about. And I thought I knew what I wanted. And when I had my consultation with my surgeon, he said one sentence that totally changed my idea of what I wanted to have. So hopefully this will be really valuable information for you. I'm going to start with the 2 most common ones, the sleeve and the bypass, and then we'll go into some of the other procedures that are available. All right, let's start with the gastric sleeve. And I do want to say a couple of things up front first. Your decision should be made with your surgeon, and your decision is not just like one or the other, but you should think about your lifestyle and what changes you're willing to make with your lifestyle. You should also think about your health because different procedures can help with different health issues more than others. And then there's some procedures that you want to avoid depending on what conditions you might have. For example, if you have acid reflux, you're going to want to talk to your surgeon about procedures that might make acid reflux worse or might cause new onset acid reflux and avoid those. And it also depends on your BMI. There are some procedures that are better for people with a higher BMI than others. So let's start with the gastric sleeve. The gastric sleeve is the most popular weight loss surgery. It removes 80% of your existing stomach. Now, just to give you a baseline, your stomach right now, before surgery, holds about 40 ounces of food. The sleeve removes 80% of your stomach. It is not reversible because that part of your stomach is gone. Your final stomach is going to be shaped like a banana or a tube. And it can be a good starting point. Like some people succeed and reach their weight goal on a sleeve, and then some people, they use the sleeve as a starting point and then get a later revision to another procedure like a bypass or a switch or a procedure called a SATI, and I'll explain that later. You can expect to lose 50 to 70% of your excess weight with the gastric sleeve. The way that it works is that it restricts how much food you can eat because 80% of your stomach is gone. And then the part of the stomach that's removed is the part of your stomach that generates a lot of or produces a lot of appetite hormones. So it affects your hormones as well as how much food you can eat. The sleeve is a good choice if you want to avoid a side effect called dumping, which is really unpleasant. I'll make another video where I explain side effects and we'll explain dumping. And then some of the risks with the sleeve are hernias, acid reflux, ulcers, and constipation. So that's the gastric sleeve. All right, let's move on to the gastric bypass, the RNY gastric bypass or the traditional gastric bypass. This is the second most popular weight loss surgery in the United States. This is considered the gold standard because it's just been around for so long. This is how it works. The surgeons divide your stomach using surgical staples into 2 parts. The part that your body is going to actively use after surgery is going to be about the size of an egg, and the rest of your stomach is bypassed. And then that little pouch is going to be connected to your intestines in 2 points. The way that it causes weight loss is number 1, restriction, because that pouch is a lot smaller. You can't eat as much food. The part of your stomach that was bypassed produces a lot of appetite hormones, so that will be less of an issue. So it helps to manage those appetite hormones. And then the third way, which is different than the sleeve, is that it causes malabsorption because some of your intestines were bypassed. So your body's not absorbing as many calories as it used to. This surgery is reversible, but it's really complicated. Some of the risks are nutrition deficiencies. Because some of your intestines were bypassed, not only is your body absorb fewer calories, but it also absorbs less nutrients. So it's even more important that you really stick to a vitamin regimen, and your surgeon may recommend a bariatric vitamin that's formulated specifically for the surgery types that bypass or reroute your intestines, because there can be issues absorbing particular vitamins. So you're going to, think about that, about your lifestyle going forward after surgery. This procedure is good for people who have a BMI of 40 or higher, and any weight loss will improve other health conditions. But if you have type 2 diabetes, or you have sleep apnea, or you have heart disease, or you have some other conditions, talk to your surgeon to see if this might be a better procedure for you than something like the sleeve or another procedure. Some of the risks are similar to some of the ones with the sleeve, but there's a couple of others. So dumping syndrome, like the sleeve, the nutrition deficiencies that I mentioned, constipation, leaks, and hernia and gallstones are also risks. All right, let's talk about the mini-gastric bypass. This is a newer procedure than the traditional RNY bypass. And so far, early studies show that it is just as effective, or maybe even more effective, than the traditional bypass. It's considered safer than the traditional bypass because instead of connecting your stomach to 2 points of your intestines, there's only one connection. So it takes less time in the operating room, and there's fewer connections to cause leaks. The other difference is that instead of your final stomach being shaped like a pouch, it's shaped like a tube or a small sleeve, about the size of a small banana. But unlike the sleeve, your entire stomach is still in there. It's just been divided into these 2 parts. The other difference between the sleeve and a similarity with the bypass is that your intestines, about 7 feet of your intestines, are bypassed. So it's reversible, but this is not done very often. Research shows that it's also just as effective at treating type 2 diabetes as a traditional bypass. And there was one study in 2020 that showed the mini-gastric bypass is actually more effective for weight loss than the traditional bypass. The study showed that the average weight loss for mini-gastric bypass was 73% of excess, compared to the average weight loss for the traditional bypass, which is 60% of the excess. There is a risk of new onset acid reflux with the mini-gastric bypass, or making existing acid reflux worse. You also have the risk of nutrition deficiencies because of the malabsorption from the intestines being bypassed. So you really got to stick with the vitamin regimen, and you may need vitamins, again, formulated for people who've had some intestines bypassed. There are not, because it's a newer procedure, there are not a lot of surgeons in the United States that do this. It's more popular outside of the United States. Okay, now we're going to talk about a procedure that's commonly referred to as the switch. You'll see the letters BPD-DS to describe this procedure, but most people just refer to it as the switch. This removes 80% of your stomach, just like the sleeve. So it's kind of like the sleeve with some of your intestines bypassed. So, and this is where I made a mistake, because you may remember me saying in another video that I went to 2 different surgeons before I settled on a third surgeon. And the first surgeon that I saw, when I talked to him, I went in thinking I wanted the bypass, but my BMI was almost 50. I think my BMI was 48. And I had type 2 diabetes and severe sleep apnea and a lot of other conditions. And so when he talked to me and listened to my health, he said, I think the switch would be a good procedure for you. And that's the statement that totally changed my idea of what procedure I wanted. because I switched surgeons, the first time I switched surgeons was because my insurance wouldn't cover it. And we'll talk about insurance and financing surgery in other videos. But I was convinced that that was the right procedure for me. When I went to the surgeon that finally did my procedure, I looked at their website and I saw the mini gastric bypass. And because it's similar, I thought they were the same procedures. They're not, but the differences are really subtle. So if this comes up in your consultation with your surgeon, just be sure you're clear that you understand which procedure you're getting and what it does, and what your lifestyle is going to be like. So the switch removes 80% of your stomach, just like the sleeve. So you're going to have a tube-shaped stomach. It bypasses some of your small intestines, like a bypass, but it's going to be at a different point in your intestines. This is a good procedure for people who have a really high BMI, a BMI over 40. It's very effective at controlling type 2 diabetes, and some patients go into remission with type 2 diabetes, which is huge. That's just really huge. This is a complicated procedure, so it's not performed very frequently. And it's only partially reversible. They can't reverse the stomach part because that part of your stomach's removed. They can reverse the intestines part, but again, it's complicated. This can cause 70% of your excess weight loss on average. There's another procedure that I'm going to talk about next called the SADI, which is similar, but it's also simpler. With this surgery, again, because part of your intestines are bypassed, there's a risk of vitamin deficiencies because of the malabsorption. So you're going to have to take vitamins, and your surgeon may recommend a vitamin that's formulated for people who have that malabsorption as a result of their surgery, to compensate for the vitamins that you're not absorbing. In terms of risks or side effects of this procedure, it can change your bowel movements. Your bowel movements can be looser, and some patients end up going to the bathroom 2 or 3 times a day for bowel movements. All right, that's the switch. Okay, let's talk about the SADI. The SADI is similar to a switch, but the real difference is that instead of being connected to 2 points in your intestines, it's only connected to 1 point in your intestine. So in the operating room, the SADI takes less time and it's considered a little bit safer. Your final stomach is shaped like a tube, and 80% of your stomach is cut away. So this is not a reversible procedure. For some people, the SADI can be their first weight loss surgery procedure, but there are people who have the sleeve and then they need to convert to another procedure, and the SADI is one of the options that the sleeve can be converted to. This is a great procedure. The SADI is a great procedure for people who have a really high BMI of 40 or higher. And also, it's very effective at helping to manage type 2 diabetes or putting type 2 diabetes into remission. You can expect to lose up to 85% of your excess weight. Like the switch and like the bypass and mini bypass, because some of your small intestines are bypassed, you have the same malabsorption issues, so there's a risk for nutrition deficiencies. So you're going to really need to stick to a vitamin regimen. And then it has similar side effects or side effects really as the switch in terms of changing your bowel habits. So you may be going to the bathroom more often. Okay, so now I'm going to talk about 2 other procedures. I don't want to spend a lot of time on the next one. The next one is called the gastric band. And the reason is because fewer surgeons are performing this because there have been so many complications with it. People who aren't familiar with the gastric band, they initially read about it and then they assume that it's safer because it's reversible and because it doesn't really cut into your stomach, or, like your stomach's not divided, your stomach's not removed, your intestines are not bypassed. So people assume that it's safer. But in fact, there have been a lot of people who have problems with once the band is in there. So the band basically is like this band that goes around the top of your stomach to restrict how much food you can eat. And, then the tightness of the band can be adjusted and to help you lose weight. So some of the problems have been like the band slips or the band starts to erode. And then so as many as 50% of people who have the band need to have some kind of surgery to correct all of that or to have it removed. So because of all of those complications, like if you were my friend, I would tell you to look at another procedure. And you are my friend, right? So I would look at another procedure just because there have been so many complications and there aren't that many surgeons who do this procedure anymore because of all of those complications. The last procedure I'm going to cover here is becoming more popular. It's called the gastric balloon or intergastric balloon. This is an inflatable balloon that is put into your stomach to reduce the capacity or how much food your stomach can hold. So this is not a surgical procedure. They don't divide your stomach. They don't cut your stomach. They don't do anything to your intestines. This balloon is left in place for 6 months, so it's reversible, and the amount that it's inflated can be adjusted over time. Okay, so those are 7 procedures that you should know about for weight loss. Hopefully you have a better understanding of which each of them are, and you can go to your consultation with your surgeon with a better idea of what your options are. Maybe you might have a short list of which ones might be the right one for you after watching this video, or you might have a short list of questions to ask your surgeon, and hopefully you can make a more informed decision when you do have your consultation with your surgeon. If you need help figuring out how to plan your bariatric surgery, I offer one-on-one peer support calls. So this is not a medical call. I can't give you any medical advice. I'm not a surgeon or any kind of care provider. What I do is I help you plan a roadmap to help you find a surgeon that's right for you, to help you understand the differences between procedures, at least initially before you go have your consultation. I help you figure out how to appeal if your insurance denies you, what you need to do. Or if you're interested in having surgery outside of the country, I can help you understand how to find a surgeon. Or you may just want some support from someone who's been there and understands it. Because I understand a lot of times we have people in our lives who don't get it, and it really helps to have some support from somebody who's been there. So if this is something that you're interested in and you feel like it will help you, look in the video description and there's a link to my Calendly, and you can book some time that works for you. And I'll be happy to help you. After this one-on-one call, it's a 1-hour call, I'll send you a personalized email with a list of resources and a recap of everything we talk about. We'll talk about the things that are important to you and the things that you're concerned about. And then I'll send you a follow-up email with a recap of our call, a list of links and resources, and I'll even throw in a couple of bonuses for you to help you on your journey. So if you're interested in that and you feel like it'll help you, check out the video description and there's a link so you can book. Take care.